Today is World Emergency Day, and to tell us more about this day, we have Dr. Mala, HOD of Emergency Department from Gleneagles PGS Hospital. Ma'am, so what is the theme of this year?
Hello everyone. The World Emergency Day is celebrated 27th May all over the world to emphasize the importance of emergency medicine. Each year they have a specific theme, and the theme of this year is climate change is also an emergency. It describes a lot about how climate changes impacts the emergency department and how climatic changes bring in lethal effects and drastic effects in people's health. For example, one day the weather is very hot, the other day it is very cold, and we have unexpected rainfalls leading to lots of floods. So this post any rainy season, there is a tendency to get lot of vector-borne infections like dengue, malaria. Similarly, there is a rise in foodborne infections like cholera, typhoid, etc. So this year the emphasis is about climatic change.
So in your experience, ma'am, how different is working in an emergency department different from other departments in the hospital?
Yes. Actually, emergency department is a bit complex place, because in other departments, the patient coming, for example, if you take an OPD, patient coming to you, they'll be seated in front of you, very comfortably talking to you, and they'll be able to say what is wrong with them. But when the patient comes to emergency, the presentations are very wide. The patient can just walk in or come in a cardiac arrest, and you have a very limited time to diagnose them. On one hand, you have to deal with the patient about whom you have a limited knowledge, what has happened to him prior to the arrival. On the other hand, sometimes attenders are also be very, very anxious. You have to deal with them. So you have a lot of level-headedness to deal these patients, especially when the cases are very sick, when the patients are very sick. That way, emergency department is a bit very complex to deal with. It's a highly volatile department, and you have very reduced. Sometimes you'll have 10 patients with 4-5 nurses around, because we never predict emergencies, how many patients are going to walk in at any point. So resource management is also a bit difficult. So to be very to the point, it is a department which has wide variety of cases with high acuity, unpredictability, and limited time to deal with the patients.
So ma'am, since you have mentioned that there is a lot of cases which comes on to the emergency department, I believe there would be a high pressure in the department itself to deal with all such emergency cases in such a short duration of time. So how do you and your team members tackle this situation?
Yes, good question actually, Nisha. In emergency, it is never an individual player. Any emergency patient the treatment is always a teamwork. And we have a team of nurses, doctors, paramedics who work in coherence with each other to deal with the patient. Yes, we tend to have a lot of burnouts and stress, but we support each other staff members. We support them, give them the guidance whenever necessary. We take them away, give them a break, and also we all are an extracurricular activity. We also get involved in extracurricular activities. Take them to team outings, all that we do.
So since you have mentioned this, the ER department is about the teamwork. So how do you maintain the performance of all your team members?
So, like, you can't have a particular pattern of emergency coming in a day, or you can't predict who is going to come to you as a patient. So what we do is, first of all, we do a rigorous, proper interview before taking a staff into our department. Once they have been taken in, we will give them a professional period of 6 months where they will be getting trained, and we do regularly conduct mock drills. How to deal with a sick patient. For example, a patient comes in cardiac arrest, how will you run the code? So this continuous clinical improvement programs happens in the department to maintain our quality and patient care.
So ma'am, how do you think that what is the community knowledge on the emergency preparedness?
Okay, so to tweak this question can be tweaked a bit. Community awareness about emergencies in India is very lacking because, for example, only 2% of the Indians know how to do CPR. CPR is cardiopulmonary resuscitation. External cardiac massage is done to restart your heart. So that much gap is there. And second thing is, many a time patient won't reach you for certain time sensitive emergencies. For example, heart attack. The crucial time when a patient sustains a heart attack is first hour. You have to recanalize the heart heart attack is a condition where the blood supply to the heart gets reduced or blocked. So we have hardly 1 hour to recanalize it. More than that, even the patient comes to you, it will not be of much help to the patient. So such sort of awareness is still lacking in lot of people. So it is very important to impact lot of community education regarding these emergencies to the community. So in our hospital, we run a campaign called We Are Emergency Ready, through which we are planning to pick up volunteers who wanted to get trained in the community awareness programs. We will train them in the basic life support and some first aid measures, so that whenever they come across such emergencies, they can act fast and take the patient to an appropriate care.
So since you have mentioned that time is very crucial for any emergencies, so can you tell us more about the time sensitive emergencies?
Time sensitive emergencies. Usually in emergencies, we deal with patients who either they are, usually in our department we treat patients to prevent loss of life, loss of organ or loss of limb. This is the usual triad on which the emergency treatment is working on. So for example, if an MI patient comes in, if they are not reaching us on time, they will not be getting full benefit. Similarly, there is something called stroke. Stroke in the sense blood supply to the brain gets blocked or there is a bleed in the brain. So if there is a block to the blood supply and if we could successfully recanalize it in the next 4.5 hours, the patient will gain his functional capability. So such things can happen. So obviously when a patient who couldn't able to use an arm or leg is not the morbidity level goes there. They might be the earning member of the family. So if they come on time, we can treat such conditions also. So similarly, when you have a meeting, when any patient met with any road traffic accident, the first hour we call it as golden hour, because most of the deaths happening post accidents are because of hemorrhage and bleeding. So what we will do, if the patient reaches out on time, we can take efforts to control the bleeding and in turn reduce the death rate. So these are very important. Unless otherwise the people around them has the knowledge to go to the right place, it is very difficult to treat the patient.
On this World Emergency Day, what message you would like to give to the public about the emergencies?
So emergency medicine has improved very vast in our country in the last decade. So all hospitals, almost all big hospitals run emergency department 24/7 and almost round the year. So it is very important to have knowledge about emergencies and to go to the right place to take proper treatment.
Thank you so much for this interview.